All right, I want to go over TMJ exercises and what you can do to be able to open up your mouth longer, or not longer, but wider, and be able to move it in all the different directions without pain, and maybe hopefully stop that pain that you get from chewing or even maybe clenching your teeth when you sleep at night. One of the biggest things with the TMJ joint is posture, so we have to look at that also besides what we're doing here. But that TMJ joint is not a very big joint, but just kind of sits in there into the condyles. When your head is back, it's relaxed. When your head's forward, it kind of sits up front and makes those muscles work harder. So posture is a big thing that will give you a long-lasting TMJ relief. But let's show you some specific exercises you can do to, get some pain out of that jaw now. So there's basically four main muscles. You got two that are on the outside, the temporalis and the masseter, and you got two on the inside, which is your medial and lateral pterygoids. So like anything that we do, we want to stimulate the brain sensory first, because sensory leads to motor output. So we just want to work up into the muscles up in here, and just bite down a little bit, and you can feel which muscles they are, and then bite down hard, and you can feel the muscles on the outside. What I won't do on video here, because I didn't wash my hands, is stick my finger back there, but you can go back in there and kind of massage and stimulate the two that are on the inside there, the pterygoid muscles in the inside there. So you go in there and do it. We also, like everything else we do around joints, is work the lymphatic system. So you got lymphs through here, you got lymphs through here. So again, just massage, circular, pat, big nodes are down on the bottom of your jaw line there, and then you got a lot through here. So I just kind of rub, and then work in here. So hopefully you're familiar with lymphatic drainage now, but everything's kind of coming down towards this direction and through there. So once you got that lymphs working, now we can kind of start to look at the jaw. What I always learned, I don't know if this is scientific, but do the 3-finger test. So take 3 fingers, and your mouth should open up so you can get 3 fingers in between your teeth. I don't know if that's, exact science or not, but that's what we learned in school. So that's kind of our goal. And you can see today, I'm doing pretty good. So, but there's times I think everybody wakes up with some jaw stiffness, tightness, or some days you just can't move it as well as you can. Before we get into this too, we want to know what the neutral position is. So standing up straight, elongated spine, and then when we start to do the jaw thing, we want to tilt your head just a little bit into the neutral position, and then open your mouth as we do this. And I like to do it in different levels too, but just start with just a little bit of an opening there, and you might feel a click. A lot of people do. Let's stop before we get to that click and start to do our range of motion in the different directions before that click, and you'll find you'll probably be able to get more motion or more opening as we go along too. So, all right, let's go with the first one. It's the lateral glide. We're going to do 5 reps each side. You can do 3 to 5. I'd like you to do this a couple times per day if you really do have some inflamed, joints in there or pain with movement there. So first one's lateral glide. So we're just going to neutral position, tuck the chin a little bit, open up, and follow with me. All right, and what could make that a little bit better is following with the eyes. So what I do is, again, we're tapping into the midbrain, and the eyes work with the nerves that we're using for this movement here. And if you want to get even a little bit more, you can turn the head with it. So you can go turn the head, open, like that. So you can work on this and play around with it, but that's the first set there of lateral glides. Now we want to do A to P, which is, either posterior to anterior or anterior to posterior. So again, we're going to open up, neutral position, head tilted, and go forward and backwards. And what I don't want you to do is do it with your neck. So your head should stay still. So I'll do it from the side or an angle here. So we're going to go forward and rest your jaw. And if it gets tightened up, again, you can just, again, do a little sensory in there. Now the third one with this one is full circle. So we're going to kind of bring our jaw, forward, out, up, maybe go back and down. So there's not a wrong way of doing it, but we're just going to get a circular motion and try to come in and out with it a little bit. So let's try that. Let's do 3 one way, and we'll go 3 the other way. Ready? Now let's go 3 the other way. All right, and again, sensory it out. Right now too, you might be getting some new lymph release through there, so work that down there too. So that's kind of the basic range of motion with there. And now we want to get some resistance with it, some isometrics. And so I either use a band or my fingers. We'll use my fingers for this one, but I want to show you could use a band here and do a little resistance with it. Let's use our fingers here, and we do have a sheet. You can download this one from our website, or we'll give it to you here if you request it, but it has these different exercises in there too. So we're just going to use our fingers. Isometric means you're doing a contracted muscle contraction, but without movement. So we do a lot of this with shoulder problems when people have frozen shoulders and can't move it. We do isometrics with it there. We're going to do it with the same jaw thing. So almost the same motion. So we're going to start with lateral. Again, remember to have the eyes follow even if it's not moving. So I'm going to go here. We're going to do 3 times or 5 times this way. And you can build up and start holding that longer and longer. I'm just doing a short version right now, but I can start to hold it for 3 seconds, 5 seconds, 10 seconds. Right there. And you see I got a little fatigued on that side, so my jaw started going up instead of straight over there. So watch that. Try to open it out. Come straight across there too. Then we want to do resistance anterior. So I'm going to open up my jaw, and then you want to start it out a little bit and then add the resistance. Just like that. Now, posterior might not be good for everybody, especially if you've got a really inflamed, back of your jaw there, but we can do this posterior. You've got to kind of grab your fingers and put them right at the bottom of the jawline there. And then I'm just going to push back on them. So open up. Just like that. And you'll be able to feel that the muscles tense up on your fingers there too. So that's the posterior way of doing it. And then the last one is you can do full circles with resistance. This one again might not be for everybody, but go ahead and try it. And there's no right or wrong way to do it, so I'm just going to start this way, this way, this way, this way. Like that. So, get creative, go forward, backwards, around, 3-dimensional with that jaw muscle there too. Last one you can kind of add is open and close. So open it out. Try to resist the closing. Just like that. And for some people, your jaw might be inflamed right now or tired, fatigued because your muscles are so weak. You can stop at any time and pick it up as you go along. I would just always start up with that sensory because sensory stimulates better motor movement there too. So those are the main ones for the TMJ, moving the jaw. But what we also, like I said, talk about posture a lot too. So what you could add afterwards is chin tucks. You know, so like that. We could work the pecs. If the pecs are tight, they usually round the shoulders, the head comes forward, and the jawline goes down. So stretching out the pecs on the door. You can work the mid-back muscles, rowing type exercises. And again, if you want to add resistance with the band, you can do that same thing. Put it here, and I'm going to go that way. I'm going to go this way. I can resist going forward. So you can do a lot with these band things too. So try that out for me. And like I said, let's do that 1 to 2 times a day and see. Our main goal is to get that jaw moving, fully open, right, left, and all the different directions. Thanks, and have a great day.